help them identify those shortages so they can, in fact, fill the gaps that are out there that are likely to be out there in the coming years. Now, about the bill itself, just a few things. You've heard this from the President, although he doesn't necessarily talk about this bill as such. But keep in mind what will happen if this bill were to be passed, okay? And again, we're really at the beginning stages. There's no bill as such in the Senate, and we have a conference committee. The President hasn't even offered a bill as such. I'm talking about this bill, H.R. 3200. If you're uninsured, you'll have a real opportunity to get insurance. And the whole issue of pre-existing conditions, there's nothing partisan about that, folks. People on both sides of the aisle agree that if you have a pre-existing condition, you should not be denied coverage, and that will be guaranteed. Rescissions, right? That's a fancy term for if you get sick, if you get cancer, whatever, no longer will your provider, your insurance company, be able to go out. There will be caps put on out-of-pocket expenses, $5,000 per individual, $10,000 per family. So that if you do have a catastrophic illness, if you do have an illness that's going to cost $250,000, $750,000, $1.5 million, whatever, you won't go bankrupt because of the cap on your. I'm going to open it up now for Q&A, comments, whatever. There are a lot of things I'd like to talk about with respect to the 2nd District. Benefits for the 2nd District of Iowa. Perhaps we'll get to those as we move along. And since we started a little bit late too, I think we have to go a little bit longer than we were planning to go. Does that sound okay? Right. She did such a great job in Cedar Rapids last week.
Thank you. Roberta on Gilbert Street. Roberta?
Yes, this is questions or comments. And I have a comment, sir, not a question. And my comment is the 3 points that I'm concerned about as a pro-life advocate in Iowa City. The first point is no mandates of any kind for abortion. The second is protect freedom of conscience for all. And the third is no mandates that encourage any form of euthanasia.
I can speak to the first and the third for sure, but the second, a little less certain on as far as the bill, although my impression is that if you're talking about providers in particular, there's nothing in the bill that would in fact force a doctor, if that's what you're concerned about, to exercise his or her conscience as far as providing abortion. There's nothing in the bill that will force any provider to provide an abortion if he or she has qualms, a crisis of conscience, or whatever about that. Keep that in mind. Second, there's also nothing in the bill that mandates that there be any coverage for abortion. Please keep in mind, again, I'm glad the President went on the radio today to talk about some of the myths that are out there, the misinformation, the lack of information. There's a lot going on out there that isn't true as far as the bill is concerned. And so I'm glad you brought these 3 things up so we can kind of clarify some of this. As far as abortion is concerned, this bill, and in particular reinforced by an amendment by Lois Capps from California, basically means with this bill that the Hyde Amendment, which includes which is a provision that says no federal funding for abortion, that will in fact be the case. That will remain the case under this bill and reinforced by the amendment from Lois Capps from California. She got that added at the end of the Energy and Commerce Committee. So there are 3 committees working on this. Euthanasia. There's nothing in this bill that calls for euthanasia. Absolutely. about death panels, talk about forcing people into end-of-life consultations. A lot of misinformation out there, and unfortunately, there have been some politicians who've been sort of stoking the fires on this. I'm very disappointed. I'm very disappointed, I have to say. But what this bill does, quite simply, in terms of end-of-life consultations and advance directives and living wills and all the rest, the only thing this bill does is it provides a Medicare reimbursement for MDs who you decide voluntarily you want to talk to, so you can get all the information you think you need to make those end-of-life decisions. If you want to go to an MD and talk to him or her about a living will, or about what you're going to do if you have some kind of terminal cancer, whatever the case may be, you can do that now. If this says you may do that, there's nothing mandatory about it, you and your family, whatever. And all this says is if you do that and you consult with a physician, that physician now can get Medicare reimbursement for it. That's all that it says.
Leslie already covered what my question was. I just wanted to make certain that you are ensuring that there are provisions for people that can access and get health insurance independent of their jobs who have pre-existing conditions.
That's right. That's right.
So you were saying that is in the bill.
That's exactly right. And in fact, now I was talking about if you're already covered, for example, right? Or if for some reason lose your coverage. If you are not covered and you want to get health insurance, there's nothing in terms of pre-existing conditions that will stop you from getting health insurance. Keep in mind that if this bill were to be adopted, it wouldn't go into effect until 2013. 2013 is a long ways off, that's right. We have a lot of problems we have to deal with in our healthcare system. I think everyone can agree with that. It's a question of how we're going to do it. But as far as pre-existing conditions are concerned, we have an amendment in our committee that was adopted, Joe Courtney from Connecticut, adopted on a bipartisan basis, folks, that no one even called for a roll call vote in the committee. We just adopted it by voice vote. That will, in fact, shorten that time frame so that we can make sure this goes into effect sooner than 2013. Shortens the amount of time that it still gives employers 30 days to look back, it's called, right, about pre-existing conditions, but it does shorten that time until 2013. It shortens it to 30 days. Okay.
We'll do this question from Bill Lynch. So if you'd like to raise your hand, and the next one, Stephen, we're going to do the question from up there.
My question is concerning politics in general. My view of politics is most congressmen and senators are only interested in the next 4 years or 2 years as elections go on. And that's for Republicans and Democrats. So my question is concerning unfunded liabilities. Now, there are three major unfunded liabilities. The first is Medicare, Medicaid liability. That's $39.5 trillion. The second one is Social Security, which is $10.7 billion. The third is prescription drug liabilities. That's $8.5 trillion. Now, the question is, the total is close to $59 trillion between those three. If you add every American in America, divided between all Americans, and my son told me he's having a child here in February, his cost for those liabilities alone is almost $200,000 the day he's born.
Right.
What's your view on spending my grandchildren